So this is a case of non-clearing hemophthalmos, and it's a diabetic retinal disease, obviously. So I started to clean the vitreous, and normally at this stage we see the vitreous because it is blood-stained, but later on I used fluorescein inside, and I found a lot of vitreous remnant. Basically, since 1971, when Mahemer introduced the vitrectomy as a procedure, we sort of guess where is the transparent vitreous. There are a lot of techniques of staining or light highlighting the vitreal fibrils, but here with fluoroscopic visualization based on excitation light and also special digital filter, which, as I said, is a custom-made color channel, which is available in the Ingenuity for a long time ago. Just you need to play with it. You can see fairly well the stained vitreous, especially in the periphery. Here is where the fluorescein is actually better than the triamcinolone, which is a classical method of staining the surface of the vitreous. Here we have stained stroma, if I might say, about this tissue. So with indentation, you can clean all the vitreous inside the eye. It's debatable should you do it or not, but for the sake of the visualization of the vitreous, you can see quite well where is the stained vitreous here. And the next step of the surgery would be probably IOM peeling. I'm just showing how we might miss some spots, especially around the trocars during our surgery, since the normal vitreous is absolutely transparent. So there are different types of filters for highlighting the fundus. This is not a natural image of the fundus. And later on, this is a blue-based filter, something that Alcon will provide in a 1.5 version of their software, which is, they call it Blue Boost. But basically, the idea is to enhance the details and the contrast according to the dye. So you might anticipate that there probably should be a filter for ICG. Probably we will create one. But since in our country we basically use blue-based filters, blue-based dyes, the effort is to have enhancement of the stained tissue. One of the other benefits is also that it reduces the reflections from the instruments, so it might be useful. Here you can see the pale retina, and this actually helps the contrast between the blue stained ILM. And the next step is intraoperative fluorescein angiography. In that case, it is achieved with excitation filter mounted on the constellation. And you can see clearly well how advanced is this diabetic case. I mean, there are a lot of areas of non-perfusion. So you might debate why we need to see that. Because we might do a selective endolaser, which is guided real-time on the fluorescein angio. Here is the moment that I need to say that the effect of fluorescein fades out, so we need to be a bit more hurry in order to see the zones of non-perfusion and to laser them. Why that is important, in my opinion? Because we normally, at that stage, might assume that we will do a total PRP, but when you laser a perfused retina, not healthy one, but still perfused, I believe we induce a different type of inflammatory response compared to the already non-perfused areas, which is directly related to the postoperative result. This is an assumption. We still need to gather cases to prove the concept, but now at that level, at least, we can see quite well the areas of lack of perfusion, no capillaries, And another thing which is interesting, that there is no choroidal perfusion also, which I think plays a huge role as a, let's say, predecessor or predictory factor of upcoming MVG probably. So here is the intraoperative guided laser, and you can see that on the temporal part, the laser is more heavy compared to the perfused retina. Next thing that you might do is endodiathermy under fluorescein guidance. In that case here, it's obvious where are the spots. But anyways, it can be useful to check if there is a active bleeding. Thank you.